We'll grab our foam roller, beginning with unilateral rolling of our calves. Let's start with your dominant leg. Fingertips are facing the buttocks or to the side. Soft bend in the elbows. You should be rolling from the top of the calf, right near the knee, all the way down to the Achilles, keeping the leg parallel and the foot dorsiflexed. You can play around with external rotation of the leg from the top of the hip socket. Keeping the foot dorsiflexed is important with flat back posture to combat the plantar flexion in the ankles. Now let's start to focus on our breathing. Thinking about how we're breathing is important in learning how to contract the deepest layer of your core, the transverse abdominis. So before we begin, make sure your tailbone is reaching back towards your hands behind you, so you have a little lumbar extension, and you're bracing your abs like you're going to be punched in the gut. Now go ahead and switch sides. And once you're set up, inhale through your nose. Pull your belly button in towards your spine like you're putting on a tight pair of jeans. And lift up internally on those muscles that stop your stream of pee. Hold that lift with your belly pulled in towards your spine and sustain it as you exhale the air out of the mouth like you're fogging up a mirror. You should feel a low belly burn. Inhaling through your nose, pull the navel in towards your spine. Lift up internally, so this isn't a movement that anybody would visually see. This is an internal lift of the muscles that stop your stream of pee. Hold that lift and fog a mirror with your exhale, sustaining the lift of the pelvic floor. One more time, inhale through the nose. Draw the belly button in towards the spine. Brace those abs, keeping the brace. Exhale the air out. We'll set the foam roller to the side and grab our anti-burst ball. Come to lie on your back, supine, and slide the anti-burst ball under your sacrum. Find some lumbar extension, taking your pointer fingers and bringing them to the bony protrusions of your hips, guiding them down so that your low back is arching. Keep your abs braced here to support the low back in this position. And now guide those bony protrusions back to a neutral pelvis. Moving back and forth from extension to neutral pelvis will feel great for releasing the low back before we begin our lower ab series. Exhale as you slip into extension, moving down into that low back arch, and inhale as you bring it back up to neutral. Exhale down, inhale up, and exhale down, inhale lift. Small movement, just an isolation of the pelvis. Using the breath, using those contractions of the transverse abdominis, the navel to spine, the lift of the muscles that stop your stream of pee. Let's take our hands down to the ground, pressing our arm extensors, the triceps, the wrists, the palms, into the ground to stabilize the torso. Think about your sternum melting in towards your spine and your back ribs pressing heavy into the floor. We're going to float up our non-dominant leg. So whichever leg is the weakest, whichever side of your abdominals is the weakest, it's usually your non-dominant side. From here, we're going to take tabletop lower and lifts. On a count of 3, we'll lower, and on a count of 3, we'll lift. Inhaling to lower with a dorsiflexed foot, 2, 3. Exhaling to lift, 2, 3. Inhale, lower, 2, 3. Brace those abs, reaching the tailbone away. Exhale, lift up, 2, 3. Inhale, lower, 2, 3. Brace the abs. Exhale, lift, 2, 3. Inhale, lower, 2, 3. Brace and lift, 2, 3. Make sure the rib cage isn't pushing out, that you're keeping those back ribs pressed heavy into the floor. The sternum is melting in towards the spine. The shoulders are melting down the back, not elevating up near the ears. Go ahead and switch sides after your next one. Setting up with a nice dorsiflexed foot, working for pelvic stability, so watching out for rocking in the pelvis here. Lowering on that 3 count, pulling the abs in, lifting up on the muscles that stop your stream of pee to lift the leg back up. We inhale, lower, 2, 3. Exhale, lift, 2, 3. Inhale, lower, and make sure when you bring the leg up, the knee doesn't track close to the chest, that it's tracking right over the hip. This will really challenge the lower abdominals. The more you bring the knee in towards the chest, the more of a modification you're doing, and you're going to grip and use more quad and hip flexors. We want to train the low abs here. We'll get into quad and hip flexor work in a bit. After your last one here, place the foot down and pick the pelvis up, sliding the ball out. We'll put it between the inner thighs now, opening our arms out to a T, imprinting the backs of the arms, the knuckles, the shoulders, and make sure that the wrists are not above the shoulders, that they're slightly below. Imprint the back ribs, close the rib cage, sternum melting in towards the spine, reach the tailbone away from you. Find that lumbar extension and float your legs up to tabletop. We're going to take some supine twisting for the transverse abdominis, taking the knees to the right, head to the left. At the bottom, we pulse in on the ball. 2, 3, 4. Pause, inhale, brace your abs, and bring the legs back up to the starting position. Make sure the tailbone's reaching away, creating lumbar extension, and other direction, twisting. Exhale, pulse in on the ball. 2, 3, 4. Inhale, prepare. Brace the abs, and exhale, lift back to center. Inhale to lower the legs. Exhale to squeeze in on the ball. 2, 3, 4. Inhale, prepare. Exhale, come back up to tabletop, remembering the knees are tracking over the hips. They're not pulling in towards the chest. Tailbone reaches away, sternum melts in. Taking it to the other side, inhale down. Squeeze, 2, 3, 4. Inhale, prepare. And exhale, lift back up to center. Let's do 2 more on each side. Taking that twist, squeezing in, 2, 3, 4. Inhale, prepare. Belly button to spine. Lift up on those muscles that stop your stream of pee back to center. Inhale to the other side. Exhale, squeeze. 2, 3, 4. Inhale, prepare. Brace those abs. Exhale, bring it back to center. Feet are dorsiflexed. Tailbone reaches away from you. Inhale, lower. Exhale, squeeze. 2, 3, 4. Inhale, prepare. Exhale, back to center. And last time. Inhale, lower. Exhale, squeeze. 2, 3, 4. Inhale, prepare, brace, and exhale, lift back to center. We will come off of the ball, setting it to the side. We're going to we'll take the ball and we're going to place it behind the shoulder blades. We're going to work on our rectus abdominis, and we'll take the hands behind the head, tucking the chin to create a double chin to engage the neck flexors. Feet are on the ground, knees pointing up to the ceiling. Slow 3 count up and 3 count down, pressing the back ribs into the ball as you go up and down, reaching the tailbone away to keep some lumbar extension. Exhale, lift up. 2, 3. Inhale, lower. 2, 3. Exhale, lift. 2, 3. Inhale, lower. 2, 3. Exhale to lift. 2, 3. Inhale, lower. 2, 3. Keep that tempo going. I want you to think about your sternum, reaching for your spine, your back ribs pressing into the ball both when you go up and down, tailbone reaching away. We're working the outer upper layer of the core here. 1 more. Great work. Let's go ahead and grab our foam roller, and we're going to tie the lightest Theraband around it in a knot coming against the wall. We'll lie supine with both feet anchoring the roller against the wall. You're going to keep one hand by your side, and we're going to do angels, snow angels on the floor, imprinting the backs of the arms as we slide up all the way with the arms overhead, trying to keep our back ribs, our shoulder blades imprinting into the floor as we do this, engaging the abdominals, and then sliding back to the hips. Going at a nice slow tempo as to not pull the front of the shoulder, lifting up and lowering down. Make sure you're breathing here. Inhale to lower. Exhale to lift. The resistance is on the way up. Once we start going down, the resistance gets easier. Don't think so much about the weight of the band. Think rather about how heavy you can imprint your body into the floor. We're trying to create more back awareness to combat the kyphosis. Let's go ahead and sit up, switch the roller, come back down. We'll put our feet against it and begin on the other side. Imprinting the body, focusing on making sure that you're imprinting evenly on both sides of the body. Since you're working one side, the other side shouldn't be lifting or hiking up. Be aware. Close those front ribs, reach the tailbone away, still keeping some lumbar extension. Your feet are dorsiflexed, again, great to combat the plantar flexion. And you're breathing, you hear your exhales like you're fogging a mirror. Or if you're bracing, you can make a sound like that, as if you were being punched in the gut. All of which will contract that transverse abdominis. Let's move into a prone position now. Taking the roller, you can take the band off of it. Lying prone, we'll have the roller under our forearms, slightly above them. And once you're set up, the palms should be facing in towards one another. Bony protrusions of the hips anchored into the floor. Abs pulled in and up. We're going to lift into upper back extension, exhaling to lift. Inhale at the top, pull the abs in, brace them. Staying here, exhale the air out. Shoulders are plugged down the back. Inhale again, brace the abs, and exhale, lower back down with control. Inhale at the bottom. Brace the abs, exhale, lift up. Hold it here. Inhale, brace the abs, and exhale, lower down. 2 more like that. Inhale. Lift the pelvic floor muscles, come up. Inhale. Exhale, stay. Inhale. Exhale, lower. 1 more time. Inhale. Brace the abs, exhale, lift. Inhale at the top, exhale. Inhale, prepare. And exhale, lower down. Grab that band, go ahead and put it back on the foam roller in the same position on one side. We're going to set up on all fours for pointer dog. Whatever arm is weakest, let's work that arm first. Opposite arm and leg extend. The leg can stay down, toes are on the ground, or it can lift up for more of a challenge for the abs. We're going to lift the opposite arm as leg up, 2, 3, and lower, 2, 3. Keep the shoulder plug down, lift, 2, 3, close those ribs, and lower, 2, 3. Take it up, 2, 3, and lower, 2, 3. Lift, 2, 3, and lower, 2, 3. 3 more, take it up, 2, 3, and lower, 2, 3. Exhaling the air out. Inhaling to lower. Trying to not wobble on the roller, staying nice and firm through your abdomen. And lower. 2, 3. Go ahead and switch sides. Setting up. Knees tracking right under the hip. Wrist right under the shoulder. Soft bend in your supporting elbow. Palm facing in towards the face. Dorsiflex that back leg, the foot, so the toes are pointing, reaching towards you. And go ahead, begin with the arm work. We're keeping that leg in an isometric hold. The arm is just moving up, overhead, engaging the back of the shoulder. And lower, 2, 3. Go ahead and lift, 2, 3, and lower, 2, 3. Keeping that tempo. 4 more. Focusing on bracing the abdominal wall here, keeping the shoulders plugged down the back, keeping the ribs closed. You can almost think about a hand hovering above the shoulder blades and trying to puff the shoulder blades up to reach that hand. We want the serratus anterior, the shoulder anchor, to be active. And 2 more. Checking in with your breath. Let's set up for our next exercise. We'll need the anti-burst ball. And we have our lightest band tied around. Go ahead and switch the position of the roller so that we can work your non-dominant side first. We're going to do some lateral flexion, side bending with the ball between the knees, and then adding the bottom arm as a lever with an isometric hold. So let's begin taking your side bend over, inhale, add the bottom arm, exhale, hold it here. Inhale 1, breathe, exhale 1, inhale 2, exhale 2, and come right back up to center. A big thing that happens here, keep going, is the ribs pushing out, especially once you add the resistance of the bottom arm that is sweeping from your hip all the way out to that T. Palms are facing one another, shoulders need to stay down the back, and you need to keep your ribs closed. On your next one, remember we're holding for 2 full inhales and exhales before coming back to our starting position. The ball is there just so you can feel the inner line of the body squeezing in with the adductors, pulling in and up with the pelvic floor muscles. You can think about your tailbone reaching down and back, creating that lumbar extension we worked on during our abdominal work. When you're holding that isometric hold with the resistance of the band, make sure the shoulder is down the back and the ribs are closed. Let's go ahead and switch sides. Turning the roller around, setting up on your knees. The toes are tucked. And since this side is your dominant side, if it feels relatively easy to hold the position, you can challenge yourself when you're in lateral flexion to lift the toes of the opposite leg. So if you're bending to the right, you'll lift your left toes. And if you're bending to your left, you'll lift your right toes. So once you go over, you inhale, you add the bottom arm, hold it here. Inhale 1, exhale 1, the opposite toes are lifted to challenge the obliques even more. Inhale 2, exhale 2, and you bring your body back upright. Last one, taking it over, holding. Inhale 1, breathe, exhale 1, inhale 2, exhale 2, bringing it back upright, making your way off of the roller, pulling the band off, and untying the knot. Great work. Grab your anti-burst ball. We're going to bring it under the sacrum, lying supine for quadricep work. Anchor your arm extensors by your side, pressing the triceps, wrists, and palms heavy into the floor. Dorsiflex one foot, sliding it out long on the floor. Guide your tailbone away from you, creating lumbar extension. Reach the sternum in and the back ribs, sternum in towards the spine, and the back ribs press heavy into the floor. From here, we're going to lift the extended leg up, 2, 3, and we'll lower on our inhale, 2, 3. Brace the abs to exhale, lift, 2, 3. Inhale, lower, 2, 3. It's very important that you're bracing your abs to keep the low back safe, and that you're keeping the foot dorsiflexed so we can combat that plantar flexion in the ankles. So it's not about height here. I have your pelvis elevated so that the hamstrings aren't straining and doing the work, that you can find the muscles in front of the thigh and activate them. So make sure you're squeezing the front of the thigh and you're not trying to kick the leg up to 90. It's not about height here. Good. Bend that knee in. Hold it in. Squeezing the front of the opposite thigh. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3, and switch sides. Setting up, dorsiflex the foot. Press the palms heavy. Reach the tailbone away. Sternum reaches for the back ribs press heavy into the floor. And we lift as we brace our abs up, 2, 3, and lower, 2, 3. Brace those abs, and lower, 2, 3. Not going for height, simply going at a nice slow tempo, engaging the front of the thigh to build strength. Keep thinking about your breath and how you can engage those lower abdominals to support the movement and keep the lumbar safe. The deeper these TVA contractions are, your transverse abdominis, the safer your low back will be. Last one, lift up, 2, 3, and lower, 2, 3. Go ahead and hug that knee in, extending the opposite leg out, holding here for a psoas stretch. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Bringing both feet to the ground, lifting the pelvis up. We're going to grab our lightest loop band and we'll bring it around the arch of the feet. Lying supine, elevating the pelvis. Again, reaching the tailbone away, finding lumbar extension, reaching the sternum in towards the spine and the back ribs. Press heavy into the floor. Widen your collarbone. We're going to march here, dorsiflexing the foot, staying on your non-dominant side first, unilateral marching. Lift up, 2, 3, and lower, 2, 3. Exhale to lift, 2, 3. Inhale to lower, 2, 3. Taking your time. Exhale, lift, 2, 3. Inhale, lower, 2, 3. Exhale, lift, 2, 3. Inhale, lower, 2, 3. 4 more, and lift, 2, 3. And lower, 2, 3. Lift, 2, 3. And lower, 2, 3. Keep going. Close those ribs. Reach the tailbone away from you. Dorsiflex the foot. Brace your abdominal wall. Relax the chest. Tuck your chin to lengthen the back of the neck and engage the neck flexors. And finish up your last one. We'll go to the other side. Setting up with that dorsiflexed foot, being mindful of how the pelvic position is when you lift the leg up. I see a lot of people tuck their pelvis as the leg lifts up. That puts pressure on the low back. We're trying to extend the low back here. Reach the tailbone towards the bottom of the mat, away from your face, allowing that extension. And now moving on the breath, keeping the foot dorsiflexed the entire exercise. Are your arms still active? Press into the backs of the arms, the palms, the wrists. And when you do so, does your rib cage press out? Keep it soft, puddling the heart in. From here, we'll kick the band off. We'll extend one leg out long, internally rotating the leg in the hip socket. When you lift up, make sure you keep the foot dorsiflexed. Again, this is not about height, it's about building strength in the quadriceps. So lifting up on that 3 count, 2, 3, and inhale, lowering, 2, 3. Really dorsiflex the foot. So that inversion of the leg in the hip socket is going to allow you to access the psoas and the quadricep as you lift up. You're not going for height, you're going for contraction and strength work in your quadriceps and your hip flexors. And keep going. Lifting, 2, 3, and lowering, 2, 3. Nice steady tempo. Here are your exhales. Sternum reaching in towards the back body. And let's slide the opposite leg out, switching sides after your next one. Setting up, legs out, dorsiflexed foot, inversion from the hip socket, turning the leg in, pigeon-toed, and then begin your lifts, lifting up for 3 and down for 3. And every time you lift that leg, make sure your abs are braced. If someone punched you in the gut, wouldn't hurt because you're tight. Hear that breath, huh, every time you lift that leg. So it can be like you're fogging a mirror, it can be a stream of breath, or it can be a quick huh, but you hold the contraction regardless. So you sustain the lift of the pelvic floor. I prefer the, like you're blowing air out, fogging a mirror, because I can continue to hear it. When I tend to hold my breath. But I do feel those muscles contract when I make that sound. So if that is what works for you, please do that so that you're firing the transverse abdominis to support the low back. Reach the tailbone away from you here. Be cognizant of your feet. Is the inner and outer edge of the foot flexing? So the baby toes should be flexing as much as the big toe. Shoulders should be on the mat, down the back, not elevating up near the ears. And finish up your last one. I want you to take your pointer fingers to the bony protrusions of the hips and guide them down to extension and back to neutral pelvis. 4 more of those. Exhale, down to extension. Inhale, neutral pelvis. Exhale, extension. Inhale, neutral pelvis. 2 more. 2 and 1. Lifting the hips high in the air, sliding the ball out, setting it to the side. Coming up to sit. Good work. grab your heaviest Theraband and your ball. We're going to come once again to lie supine, putting the ball under the tailbone and wrapping the Theraband around the arch of one of our feet. Guide the tailbone down so that we really get lumbar extension. Dorsiflex the foot. We're working on the plantar flexion of the ankles, combating it. At the same time, we're getting a great calf and hamstring opener. Keep one arm down for stability purposes. Do your best to connect with your breath here. Each exhale is a chance to go deeper into the stretch, to bring the leg a little closer to you without bending the knee. You can have a micro bend if you have bow-legged hyperextension in those legs, if you have a bit of bow-leggedness. Otherwise, I'd encourage you to keep the legs straight and the foot dorsiflexed. Check in with your breath. Inhale through the nose, as if you're putting on a tight pair of pants. Suck the abdominal wall in, hold it in, lift up on the muscles that stop your stream of pee. Fog a mirror with your exhale. Inhale through the nose, pull the navel in, lift up on the muscles that stop your stream of pee. Pull the leg closer, fog a mirror. Go ahead and switch sides, setting up on the other side. Footwork is essential before doing standing work because we want to use all sides of the feet evenly. This will help balance the flexibility, and it will help with the recruitment of the right muscles for strength training. So again, using the exhale to go deeper into the stretch. Watch out for the rib cage spraying out. Back ribs press heavy into the floor, tailbone reaches away. Inhale through your nose, pull the abs in, brace them as if you're putting on a tight pair of pants and holding them in. Brace, brace, brace. Exhale. Don't let that belly push out when you're exhaling. Inhale through your nose, pull the abs in towards the spine. Lift up on those muscles that stop your stream of pee, and exhale the air out the mouth, holding that lift. Pulling the leg closer on that exhale. Let's come out of that stretch, making our way up to stand. We're going to bring our roller by the wall and grab a 3-pound weight and our ball. The ball goes between the inner thighs. I'd like you to start working your non-dominant arm. So your non-dominant arm should be to the outside of the wall, the farthest away from the wall. Make your way up under the roller, soft bend in the knees. You should be holding onto a wall or a countertop for safety purposes. From here, once you have your balance, I'd like you to hinge forward from your hips. Arm is relaxed down, and we'll begin some back flies from this hinged position. Lifting up, 2, 3, and lowering down, 2, 3. Taking it up, 2, 3, and lowering, 2, 3. So a good thing to think about here is the tailbone reaching away from you, so you have some lumbar extension, the belly button staying pulled in and up towards the spine. Soft micro bend in the elbow of the arm that's going out to the side, keeping the shoulder plugged down the back. Lifting up, 2, 3, inhale, lower, 2, 3. One more time. And lower with control. And slowly step off the roller. We'll set up on the other side. Take your time here. Make sure when you step up onto that roller, your knees are bent. Make sure you have a wall. Safety first. Hinge forward from the top of the hips. Soft bend in the knees. We're not in a squat. And begin your arm work, taking it up, 2, 3, and down, 2, 3. Exhale to lift, bracing the abs, tailbone reaching away and back. Inhale, lower. Exhale, lift, 2, 3. Inhale, lower, 2, 3. Exhale, lift, 2, 3. Inhale, lower, 2, 3. 2 more. Exhale, lift, 2, 3. Inhale, lower, 2, 3. Exhale, lift, 2, 3. Inhale, lower, 2, 3. We're going to come off of the roller carefully. We will grab our heaviest loop. We'll grab our heaviest Theraband and our lightest loop band, bringing the loop band around the ankles and the heaviest Theraband behind the back. Pull out on that band. This will help you find the serratus anterior, your shoulder blade anchor. Set up profile to the wall. You're going to step to the side towards the wall in the frontal plane to balance in knee flexion. Pulling out on the band, hold it here. Inhale 1, dorsiflex the foot, exhale 1. Inhale 2, exhale 2. Inhale 3, exhale 3, and bring it back. Repeating again on this side. Stepping to balance, soft bend in the supporting knee. Equal weight between the bone of the big toe and baby toe. Sternum reaching back towards the back ribs, tailbone reaching back away from you. Abs pulling in and up. Pull out on that band. Palms should be facing forward. And let's make our way to the other side, setting up. When you're ready, step to balance, keeping a soft bend in the supporting knee. Inhale 1, breathe. Exhale 1. Inhale 2, exhale 2. Inhale 3, exhale 3, and repeating. Step to balance, soft bend in your supporting knee. Dorsiflex that lifted foot. You're in knee flexion. You're pulling out on the Theraband behind you with the palms forward. Your focus is eye level or slightly higher. Collarbones wide, shoulders plugged down the back. Rib cage is closed. You can think about that sternum reaching towards the back ribs. And from here, we're going to come against the wall. We'll take the bands and set them to the side for an eagle serratus anterior release. Eagling up the arms, crossing one elbow under the other. Tailbone is against the wall. Feet are slightly in front of the wall. You're just going to round forward. The upper body relaxes, and the elbows reach away from the chest and towards the chest. Away from the chest and towards the chest. And away and towards, round up, switch those arms, rounding back down, move the arms away and towards, and away and towards, one more time, away and towards, rounding up. Turn and face the wall, step your dominant leg back, look over your shoulder, make sure it's nice and parallel for a calf stretch for the gastrocnemius, very overactive muscle with flat back posture. Drive the hips forward. Keep your focus now up, eye level in front of you. Pull the abdominal wall in. Each exhale is a chance to go deeper, driving the heel down behind you. Keep driving the pelvis forward at the same time towards the wall. Keep the abdominals firm. And let's focus on your transverse abdominis here. Inhale through the nose. Pull the abdomen in. Lift up on the muscles that stop your stream of pee. Hold that lift as you exhale the air out. Drive that heel down into the floor. Inhale through the nose. Abs in. Brace the abs. Pelvis presses forward. Heel drives down as you lift up on those pelvic floor muscles that stop your stream of pee, and you're fogging a mirror with your exhale. Go ahead and step forward. Legs should start hip distance apart. Step the opposite leg back. Look over your shoulder. Make it perfectly parallel, that foot. And then square the hips to the wall, driving them forward towards the wall. Hands should be about chest height. Focus up, eye level. Shoulders down the back. Inhale through the nose. Pull the navel in. Brace the abs. Exhale, drive the heel down and the pelvis forward. Inhale through the nose. Abs in. Brace. Drive the heel and pelvis forward, heel down. And one more time, inhale through the nose. Like you're putting on a tight pair of jeans, suck the abdominal wall in, hold it in. Lift up on those muscles that stop your stream of pee. Sustain that lift as you fog a mirror with your breath. Stepping forward. Great job. Grab your anti-burst ball. We're going to set up for wall squats. Place the ball between your knees and bring your arms with the palms facing forward down by your side. Down by your sides. Imprint the backs of the arms, the triceps, the wrists. See if you can keep them against the wall as you work here. Your feet need to be about 1.5 to 2 feet in front of you. We're going to slide down the wall to where the thighs are parallel to the floor and the shins are perpendicular, creating a right angle with the thighs and shins. Ball stays between the inner thighs and you squeeze in on it. We're going to hold at the bottom, squeezing in on the ball for 4 counts, inhaling to prepare, and then sliding back up to standing on our exhale. So we lower on an inhale, squeeze in on the ball for 4, 3, 2, 1. Inhale, prepare, and exhale to slide back up the wall. Keep your tailbone anchored on the wall. This is a great chance to see if you really are keeping your ribs closed, because there should not be any space between the back ribs, the shoulder blades, and the wall. You want to keep them imprinted, the backs of the shoulders as well. So from here, inhale to slide down into the position. Make sure the knees are not tracking beyond the metatarsals, so the toes should be in front of the knees, but the knees should track between the second and third metatarsals. Once you're back up, check your imprint, back ribs, shoulder blades, back of head, neck shouldn't be pressing in, chin can be retracted like a double chin. And sliding down, pulsing in, 2, 3, 4, inhale, prepare. Exhale to slide up with the braced abs. Inhale to lower, tailbone heavy, back ribs pressing in, pressing on the ball. 2, 3, 4. Inhale, prepare. Imprint and brace the abs to lift you all the way back up. Take that ball and we're going to set it to the side, grabbing a 3-pound weight, coming into a tightrope stance. If this feels too challenging balance-wise, go ahead and take a staggered stance where the feet are hip distance apart, but one is in front of the other. Once you've found your stance, hold the weight in the same arm as the leg that's forward. We'll take lateral flexion and add the bottom arm, holding here. Inhale 1, breathe, soft bend in your knees. Exhale 1. Inhale 2. Exhale 2. Inhale and exhale back up through center. And repeating, making sure you're not rolling onto the outer edges of the feet. Feel weight in the heels, bend those knees. Weight in both the bones of the big toes, the baby toes, and the heels. Equalize the pressure. Holding that lateral flexion, adding the bottom arm. Make sure the palms are facing in towards one another. Another great chance to work on your lumbar extension, reaching the tailbone back, creating that arch in the lumbar. Keep your shoulder blades pinching together and your sternum reaching for your spine so we close the front ribs and access the external obliques. You should have one more set to go on your breath, inhaling to prepare, exhaling to brace those abs and contract the transverse abdominis. Go ahead and set up on the other side, finding either the tightrope stance or the staggered stance. And when you're ready, inhaling over, adding the bottom arm, exhale 1, inhale, exhale 2, inhale, exhale 3, and bringing your body back upright. Remember your checkpoints, your feet, equal weight distribution. You'll probably feel more weight in the metatarsals, the toes. I want you to find your heels and really ground them into the floor. Keep a soft bend in your knees so that you don't lock out and we don't get that supination or plantar flexion in the ankles. And you've got one more set here, taking it over, closing those front ribs, bracing the abs on your exhale and sustaining the brace. for the duration of the exhale. That's it. We're going to grab our heaviest Theraband and we're going to move towards the wall, standing profile. We're going to move in the transverse plane. We'll actually start facing forward and we'll turn profile so that we have the wall to assist us if we lose our balance. Now, balance work in the transverse plane is imperative because it's where 90% of injuries occur. So you've got your Theraband and we're holding it like a jump rope. We're going to step and find our balance in knee flexion as we did in the frontal plane balance work. And now we're going to loop the band around the arch of the foot and we'll extend the leg out. The leg does not have to be straight. I'd rather you keep the knee bent but the foot dorsiflexed and arch your low back. So if you're straightening the leg but rounding your low back, that's actually very bad for your back. It's much more important to me that you work with some extension in your low back and a deep bend in the supporting knee. Let's try it again on this side. Stepping to balance first, that's very important. Always keeping a soft bend in the supporting knee, weight in the heel, putting the band around the arch of the foot, and then tipping your tailbone back but firming your core, dorsiflexing the foot. Go ahead and take it to the other side, practicing the balance, turning, finding it, looping the band around, and then holding for 3 inhales and exhales. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. And repeat one more time on this side. Be cognizant of your checkpoints. Feel your heel heavy on the floor. Soft bend in the supporting knee. Don't go for flexibility here. Go for proper pelvic position for strength in your deep layer of your core. That's what's going to alleviate chronic back pain. That's what's going to give you power and strength to bring the body upright so we don't have that forward leaning posture. Okay, excellent. Place the heaviest band to the side. We're going to take a anterior delt bicep release, face the wall, find a V position with your non-dominant arm. The outer thumb should be against the wall as you rotate around, twisting from the torso. The legs will follow. Soft bend in the knees. Close those ribs. Inhale, pull the navel in, lift up on the muscles that stop your stream of pee, and twist further as you inhale through the nose, draw the navel in, lift up on those muscles, firm them, hold the lift, and twisting exhale. Let's go ahead and switch sides. We're on our dominant arm side. We'll be here a little longer. Inhale through the nose, pull the navel in, brace the abs as if you're going to be punched. Twist into that stretch. Inhale through the nose, abs in, lift up on the muscles that stop your stream of pee, and twisting deeper into the stretch. Soft bend in the supporting knees. Feel that sternum reaching for the back ribs. Inhale through the nose, shoulders sliding down the back, abs in, brace, exhale, twist. One more, inhale through the nose, abs in, contract, and exhale, twist. Making our way into a quad stretch. Start with your non-dominant leg, grabbing the outer ankle, dorsiflexing the foot, and driving the thigh back. Soft bend in the supporting knee, holding it here. Quick release. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Going to 4. Inhale 4. Exhale 4. And let's set up on the other side. Soft bend in your supporting knee, weight in the heel. Grab the outer ankle, dorsiflex the foot. Collarbone wide, sternum soft. Inhale 1, breathe. Exhale 1, drive the thigh back. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Inhale 4. Exhale 4. And slowly release that. Great work. Grabbing the second to lightest Theraband. I'm going to have you tie it to the roller and place the roller with the band that you've tied, which should be closer to the wall than the outer edge. We're going to do some straight arm lifts that cross the line of the body on the diagonal. We're going to place the ball between the knees to engage the inner thighs and keep a soft bend between the knees. We'll take the arm, let's start with your non-dominant arm so we get more repetitions in on that side. Coming up, so for me, my non-dominant side is my right side, so I'm going to take it up, 2, 3, and down, 2, 3, focusing on strengthening the back of the shoulder, 2, 3, and down. But what's nice about this is we're getting some adductor work, upper body work, and we're working the transverse abdominis because we're unstable. We're having to balance. So I don't want you to take the hand off the wall or counter, but I don't want you clutching it. You should be using those internal core muscles for some of the balance. But the wall is always there for safety. Give me 2 more on this side, and then I'd like you to make your way to the other side. You'll have to move the band, setting up. And when you're ready, we'll begin on your dominant arm side. For me, it's the left. Taking it up on a slow 3 count. Your exhale should be on the way up, and your inhale is on the way down. Palm is facing forward. So palm faces the hip when you start there, and by the time the arm is up in the V, the palm is facing forward. Check in with your breath. Use the breath. It will help the movement. Brace the core. Make sure the knees aren't locking, squeezing in on that ball. And make sure you don't have all the weight in your toes here. I'd like some weight in the heels. You'll probably be more in the center of the foot, kind of wrapping the arch of the foot around the roller, kind of like a bird does when he wraps his feet around a branch. So you can use the arch of the foot here, or you can really challenge the balance and come more onto the heel as you're working. Make sure you're holding the counter or wall, and you feel safe enough to do that if you do choose to come to your heels. Let's go ahead and set up. We're going to do some isometric lunges with lifting and chopping. We'll need a 3-pound weight. Let's start by stepping your dominant leg back, taking the weight to the outer hip, and then up on the diagonal. So this is similar, except we're using both arms to lift and lower. And there's now a torso twist. Before we kept the body straight on, we didn't rotate the body. So I want you to engage the back, but also to engage the abdominals with this twist. We're isometrically holding the lunge to challenge the quadricep here. Give me 4 more twists, really working on the strength of that non-dominant quadricep. Breathing into that. After your 4th one, go ahead and switch sides. Since this is your dominant side, we'll do 6 here, taking it up on the exhale, lowering on the inhale. Now, if you find you don't have the balance to go that quickly, exhale to lift and lower. So pause on your inhales to prepare and lift up on the exhale, pause at the top, inhale, and lower down, exhale. Make sure the weight isn't all forward in the toes, the knee isn't tracking beyond the metatarsals, the ribs are closed, the chin's retracted, and head is back on the spine. A lot of checkpoints. Let's go ahead and set up for a series of balance work, moving forward and back in the sagittal plane. We need our lightest loop band to go around the ankles, and we'll hold on to that 3-pound weight. Do this exercise by a wall for safety purposes. You're going to step forward. Your outside leg will come up into knee flexion and you'll balance that weight. Just putting your pointer fingers there for safety. Holding, inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Hold on to that weight and put the foot down. Now I'd like you to step the leg closest to the wall back and lift the outside leg again, resting the weight on it, balance. Hold it here. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. And turning around, repeating on the other side. Make sure your foot's dorsiflexed. Do your checkpoint work, stepping to balance. Hold. Where's the weight distribution in the foot that you're standing on? Is your tailbone tipping back? Are you rounding your low back or are you arching it? Are your ribs closed? Is the head on the spine or is the chin forward? Retract the chin, give me a double chin. Keep the collarbone wide, keep the sternum reaching towards the back ribs, and repeat one more time, stepping back. So I want you to practice moving through space to balance. This will really help your proprioceptors and your neuromuscular system to fire. When you do lose your balance, you'll be able to catch yourself because your muscles are used to recovering quickly and unilateral balance work. Holding, dorsiflexed foot. And let's go ahead and come out of that, setting the loop band to the side as well as the weight and grabbing a chair. We'll need our heaviest Theraband. We'll use the chair and the wall for a hamstring stretch with the dorsiflexed foot. Let's begin with your dominant leg. Wrapping the band around it, isometric row. You can hold it with the outside hand and one hand on the wall for extra security. Or if you feel balanced today, you could hold the band with both hands and do a row here to engage the back muscles, with the emphasis being on the hamstring stretch. So I'd rather you hold on to the wall if you're rounding your low back. And it's likely you are because the hamstrings are very, very tight due to your posture. So quality versus going hardcore. Let's think about longevity and really opening those hamstrings for better range of motion. So tip your tailbone back, dorsiflex that foot hard, softly bend that supporting knee. Make sure you're not rolling out on the foot or locking the knee. And then you're hinging forward from the hips to intensify the stretch in the hamstring. And you can hear your breath. Each exhale is a chance to go a little deeper into the stretch. Great. Let's make our way to the other side, setting up. Once the chair's there, you dorsiflex the foot, bringing it onto the chair, looping the band around it, holding it with the outside arm, tipping the tailbone back, softly bending the knee, reaching the chest towards the thigh without losing the extension in the low back. Holding it here. Inhale. Exhale, deepening the stretch by coming forward just an inch. Inhale through the nose, draw the navel in. Lift up on those muscles that stop your stream of pee. And exhale to deepen the stretch. And one more time, inhale, abdomen in. Lift up on the muscles that stop your stream of pee. And exhale, lift, deepening into the stretch. Go ahead and let's stand center without the band or chair. And we're going to grab our opposite wrist, crossing one leg behind and taking a nice side body stretch here, pressing the pelvis forward. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Switch sides. And inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Great work.